The process of childbirth in medieval Japan was a dangerous and highly ritualized experience that differed dramatically from modern practices. As a GP or family physician, I can say that a lot of practices and procedures that we take for granted when delivering a baby nowadays were either not available or unknown at that time. The process at that time was viewed through both medical and spiritual lenses, with elaborate preparations and interventions designed to protect both mother and child from physical and supernatural dangers. So let's explore this fascinating topic in this video. If you enjoy comparing medical practices through different ages and different cultures, please subscribe to my channel, Doctor of the Ages. Traditional Japanese midwives, or sambas, played a crucial role in pregnancy care, but sambas were not like the trained midwives we have today. They were usually older women who had practical experience in childbirth and gained knowledge through observation and apprenticeship with elder midwives. Formal antenatal care as we understand it today was virtually non-existent in medieval Japan. Instead of regular medical monitoring, pregnancy care relied heavily on observational methods and spiritual protection. Pregnant women from aristocratic families would typically return to their paternal homes for confinement, a practice known as Satogayeri Shusan, where they could receive support from female relatives and experienced attendants. Midwives and women with experience in traditional Japanese herbalism could suggest herbal remedies for various symptoms of pregnancy or to help with the labour process itself. Yomogi, or Japanese mugwort, was often recommended as a tea and was thought to help strengthen the uterus and ease labour pains. Shiso leaves were used to combat nausea and morning sickness as well. Ginger was also sometimes recommended, and actually this is still used by some today to try and ease nausea and vomiting, particularly early on in pregnancy. Kudzu root was also believed to help with difficult labours, though like many traditional remedies, there's limited evidence for its effectiveness. There were very few means to detect complications in pregnancy, such as preeclampsia or gestational diabetes. If a woman did experience any unusual symptoms, like severe pain, swelling, or bleeding, they might seek help from a Kampo physician trained in Chinese medicine. But unfortunately, many of these cases resulted in dire consequences due to the lack of medical knowledge or limited treatments available. Most Japanese women gave birth in their homes, surrounded by female family members and the samba. Childbirth was considered both sacred and polluting in Shinto beliefs, making it a highly ritualized yet private family event. In samurai or wealthy merchant households, additional female attendants might be present. The birthing room would often be purified with incense, and prayers offered to protective deities like Kishimojin, the Buddhist goddess of childbirth. The management of labour varied significantly depending on social class. Wealthy women from samurai families might have access to experienced samba and kampo physicians, whilst less wealthy women would rely on local midwives with informal training. However, regardless of class, we know that childbirth remained dangerous in medieval Japan. Without modern medical techniques, the risks of maternal mortality from complications like postpartum hemorrhage or infection were extremely high. Complications like breech birth or prolonged labour could result in the death of the mother or baby, and there were very few effective interventions available. Kampo physicians were sometimes called upon when complications arose or when lives were at risk. So let's look at what these physicians could do to help. In cases where baby was positioned incorrectly, they might try to manually adjust the position, though this carried great risk due to limited understanding of safe fetal handling. Maternal positional changes were sometimes recommended, having the mother squat, kneel, or lie on her side to encourage better positioning. These techniques were influenced by Chinese medical traditions. Acupuncture and moxibustion, or burning dried mugwort on specific points, were commonly used. These techniques were based on traditional Chinese medicine principles of balancing qi energy flow. Different herbs including opium, poppy, cannabis, and various bark preparations could be used to manage labour pain and swelling. Sake or rice wine was commonly given to the labouring woman to try and relieve pain, but as we can imagine, none of these techniques or remedies were effective as modern pain relief options. When labour entered a critical stage, preparations were made for the woman to take Buddhist vows in anticipation of possible death. This is a practice that really highlights just how dangerous childbirth was considered. Caesarean sections were virtually unknown in medieval Japan and would only be attempted in the most desperate circumstances when the mother was already dying. The procedure was called Teikai Setsu, but survival rates were essentially zero. Ritual purification after birth was crucial, as childbirth was considered spiritually polluting and required specific cleansing ceremonies. Recovery after birth was managed by the Samba, who would usually advise on rest, nutrition, and newborn care. New mothers would follow a strict postpartum confinement period called Sango Nohi, typically 21 to 100 days of rest and ritual purification before returning to normal activities. The traditional practice of Satogieri Susan meant that many women remained at their paternal homes during recovery, receiving care from their mothers and female relatives rather than returning immediately to their marital households. This arrangement provided crucial support during the vulnerable postpartum period and helped ensure both maternal and infant survival during these dangerous early weeks. So I hope we can understand and appreciate that giving birth in medieval Japan was vastly different from today. The combination of limited medical knowledge, spiritual beliefs about purity and pollution, and social hierarchies made childbirth an incredibly risky yet deeply meaningful cultural event. If you enjoyed this video, then please do like and share. And furthermore, if you want to learn about how medicine has evolved through different cultures and ages, please subscribe to my channel, Doctor of the Ages.